My name is Shahnaz Gillani. I've been a nurse all my life. I have been at MD Anderson for 17 years. And then out of that last 7 years, I have worked as a nurse educator. Um, and so this is a really like a good opportunity. So when we talk about this project that we did, it was like the first part of it. This is like a quality improvement project that we did. So we wanted to see, so in real, before I get into the details of this, let me tell you. So for the GI colorectal surgical patients, there is 30% chance that they may develop ileus as a postoperative complication. Ileus is when the colon is slowed down and then they are throwing up, abdomen is distended and everything. So it kind of extends their hospitalization stay, and like the patient is frustrated and it just takes longer for them to recover from surgery. So we wanted to use this tool that's called iFeed scoring system tool. So the iFeed stands for intake, feeling nauseated, emesis, examination, and duration of symptoms. So this tool was not invented by us. It was from American Society of Enhanced Recovery and the Perioperative Quality Initiative. So this tool was there, but we wanted to utilize it. So what our challenge was that because, like I said, that our patients have high risk for developing ileus, because now we added this education and the nurses are adding percussion to their assessment every day and as needed basis. And we are able to detect the ileus at an earlier stage than letting it get a fully developed and have more complication from it. So that was the most kind of intent of doing this project. First of all, we had to look at the nurses, do an assessment of how many nurses you know how to do the percussion, because usually till that time, when we started doing, only the physicians or the practitioners would do percussion for the patients, right? The nurses will listen to their chest and their abdomen for bowel sounds and ask questions about nausea, vomiting, and everything. So the nurses do get the education in nursing school, but because we don't utilize it, they may not remember it. So we did a very thorough education for it. We developed a PowerPoint, and we did like simulation and check off. So simulation I did for super users on actual patients, where we could go and do the percussion. So when they're doing the percussion, they're looking for either timpani or dull sound, right? So the dull sound would be normal because that means there is some food and fluids going through the guts, but timpani is like drum sound. So that means there is a hollow, there is air trapped in it. That's the first sign for ileus. So the nurses were really enthusiastic and interested in learning and started doing this. We start doing the percussions from first postoperative day for all the surgical patients, and then they would ask these questions about nausea, vomiting, and everything. So they would do that when they are doing at the beginning of the shift for head to toe assessment, and then if the patient develops nausea, vomiting later on in the shift, then they will do another assessment of percussion. So this is a great tool because, like you have seen that, right? Like, so what the numbers it comes with, right? So if it ends up in the green zone, then we don't have to worry too much about it. If it is in yellow zone, then, their guts may be slowing down a little bit, and we have to they may be having difficulty with their oral intake, or they're belching, nauseated, their abdomen is distended. So all those symptoms are checked when we are doing the assessment, right? So that means those patients will be needing like antiemetics, and maybe they can just only sips on clear liquid, and then it may take them a longer time to resume to the regular diet. So on, those grading are there. So the red zone is the patient is having postoperative gastrointestinal disorder. That means they cannot tolerate anything, and they may need like NG tube, like nasogastric tube insertion to empty out their stomach. They will need IV fluids. They may need some parenteral nutrition if it goes on for more than a couple of days, and so on and so forth. So the education went well. The nurses started doing it on all patients' assessment and everything. And they did that for 6 months, when we did another survey with the nurses, and that was that had really good results. And more than 85% of our nurses said that this was feasible for them to add on to their assessment. And it only took them less than a minute to do the percussion. So it's another kind of safety feature for the patient. So we are assessing them before the actual problem arises. It really helps the nurses use their critical thinking, because now they are doing a little bit more thorough assessment for the patient, right? So not only doing just percussion, but they're listening to the bowel sounds, they're watching for abdominal distension and accompanying symptoms like nausea, vomiting, and all, right? So all that helps them recognize, okay, so if they already hear timpani, then they may ask the patients, hey, slow down on eating, because I think, you're developing some, it's kind of slowing down a little bit, and let me call the provider. So, we truly believe in a good handoff. Like when they call the provider, they should have all the information ready to report to the provider. So with this added assessment, it was a little bit more thorough. So they were doing it and reporting to the provider. So they really feel good about it, that they are doing their share of a thorough assessment, using their critical thinking skills, and informing the provider, so then the interventions can be taken in the timely manner. Um, Overall, the medical team and everybody is really happy with it. Um, and they also kind of boost the nurses that they're doing great job with this added assessment. So I think overall, but this was limited just for our surgical unit, colorectal surgical unit only. um, and now the next phase that will start, and I don't want to go too much in detail of it, because actually, like I said, it's a bigger team that runs this whole show. So that's when they will start collecting more data in details. Um, and we will see how much difference we will make. And then I think this education may be spread out to some other surgical unit, or especially our GI colorectal patients that goes into like transitional PACU unit or overnight PACU or something. So we will also educate those nurses eventually. Our patients may be on operating table for like 8, 10, or 12 hours because of the invasive surgeries they have. So they have more chances that their gut will be kind of paralyzed for a longer period of time. And so that's why we start them very slowly with like clear liquid diet. And if they tolerate it, then we slowly advance it, and so on and so forth. So we just have to be a little bit more cautious with cancer patients, because of they are more prone to complications with the invasive surgery. Um, I was really happy that this was presented at ONS, and like I had sent a video with it explaining a little bit or introducing the process with that. So it was presented at ONS, and a lot of people stopped by and read the information and made the comments of how much sense it makes. So I think it really, really helped the nurses feel empowered, and they said, okay, we are doing our share to keep our patients safe and prevent complications. So yeah, I was very happy with that process.